Well, we understand the briefing with the Health Minister is getting underway. Let's listen in.
For patients with confirmed COVID-19 infection is being reduced from 14 days to 10 days. This recommendation is based on the evidence that most patients with a mild COVID-19 infection continue to shed the virus from their upper airways for approximately 7 to 12 days. Furthermore, the presence of detectable virus when testing does not necessarily imply infectiousness. Excuse me. It has been proven that in mild cases, virus cultures are generally only positive for 8 to 9 days after the symptoms onset. The duration of infectiousness in patients with severe disease that is requiring admission due to clinical instability is less well established. In general, patients with severe disease may continue to shed the virus at higher levels for longer periods than patients with mild diseases. To provide a buffer, it is recommended that such patients be de-isolated 10 days after clinical stability has been achieved, rather than 10 days after symptoms onset. To illustrate this in simple terms, if a patient was admitted and placed on oxygen, we advise that when oxygen supplementation is discontinued, the patient must remain in isolation for another 10 days. This continued isolation provides clinical comfort that the patient is no longer infectious. Asymptomatic patients represent a conceptual challenge, since it is not possible to estimate where in the course of the viral shedding they are at the time point at which they test positive. We therefore advise that an asymptomatic...
I didn't catch that. Could you try again?
Sorry. We therefore advise that an asymptomatic patient must remain in isolation for a period of 10 days following the date of their positive results. I must mention that these guidelines have been provided by the World Health Organization. The Ministerial Advisory Committee has also submitted an advisory in this regard. Their advisory, after they've done a lot of analysis, proposed that the isolation period should be reduced to 8 days. After considering this advice and the guidelines by the WHO, the National Coronavirus Command Council, on the recommendation from the National Health Council, resolved to adopt the WHO guidelines. After consulting WHO and the chairperson of our clinician subcommittee of the Ministerial Advisory Committee, Professor Mark Mendelsohn, with due regard to the hard work they put into this recommendation, once we understand the basis of the recommendation, we have agreed that we should initiate further engagements between our Ministerial Advisory Committee experts and those of the WHO so that we take this discussion forward. We believe that such a discussion will enrich the processes of policy making on both our sides, taking into account that WHO has also got the oversight of many countries, but we would like to ensure that as we go through this discussion, our views and the analysis of our own experts are well appreciated by the WHO. The Ministerial Advisory Committee has also done further work that relates to supporting health workers who have been exposed to infection. This matter is also being processed. The second aspect of the issue we wanted to table to the media and the public relates to the National Department of Health track and trace system. In the past few weeks, some members of the public may have received SMSs from the Department of Health, giving them vital information, which may have included receiving their test results or an alert that they have been identified as a contact of a COVID-19 positive patient. These messages also prompt the user to provide further information on their condition in order to determine what clinical assistance and attention they may require. One of the clinical aspects of combating COVID-19 is the ability to detect positive cases early, track and trace their contacts, and refer them for appropriate management. whether it is immediate testing, isolation, or quarantine. The digital system that the Department of Health is currently using is called COVID Connect. Brings an easy-to-use self-service portal to your cellular phone. It is freely accessible through WhatsApp and SMS. What also makes it more accessible is that it does not require for a user to have a smartphone, but it works on any mobile phone. This system enhances the physical effort of contact tracing and tracking, which is done by our community health workers and volunteers. It automates this traditional process and continuously engages the affected user. To explain this process further, the system works as follows. When a patient tests for coronavirus, the information is picked up from the lab form and informs the patient of the test results, whether positive or negative, by SMS. If the result is positive, the system prompts the patient for further information in order to identify their contacts. The system then immediately dispatches alerts via SMS to those contacts without disclosing the index patient's details and prompts them on the next steps to take. The non-disclosure of the patient's name is to ensure that their privacy is protected and also to make sure that after a contact details are made available, that person's privacy is protected. In addition, the system can geolocate the nearest quarantine and isolation facility for the user and the nearest healthcare facility for patients or their contacts who are experiencing symptoms requiring medical attention. Users can also get the latest COVID-19 news and information, prevention tips and wellness advice at the touch of a button. There is also a simple risk assessment tool which will screen users for COVID-19 symptoms and give them advice on whether they should self-isolate or seek professional clinical assistance. We're pleased to announce that since the system went live in June, it has yielded some positive results. Between June 28th and July 15th, it has dispatched 674,380 SMSs to users nationwide and relayed 326,522 test results. And 39,463 users have engaged with the service. But this is not enough. The surge of this pandemic requires all citizens to participate in such innovations. As an individual at home or at work, once you receive this SMS, we urge that you take it upon yourself to appropriately respond as prompted. We believe that this method will significantly enhance contact tracing and allow us to quickly identify cases that we would not easily trace. We also want to inform the public that this track and trace service will not infringe people's privacy or data. In fact, one of the reasons we were delayed to implement and announce the system was to ensure that it passes the legal muster and adheres to the legal prescripts relating to personal information, confidentiality, and individual and data privacy. In this regard, the National Department of Health held a productive consultation with Madam Justice Kate O'Regan, who is the COVID-19 designate judge. Her guidance assisted the government to establish regulation on how to implement the track and trace system. We now take the opportunity to acknowledge the entities that the Department of Health has partnered with, namely Telkom, BCX, GovChat, PryKilt, and Bluebird. To access the COVID Connect, just add 0600123456 to your phone book and say hello to us on WhatsApp. I repeat the number, it's 0600123456. I believe that is easier. It's easy to memorize, and I believe therefore it would be easy to use. If you do not have a smartphone, just dial *134 *832 hash and follow the prompts. *134 *832 hash and follow the prompts. When you test for COVID-19, Please supply your healthcare worker with your correct date of birth, physical address, and cell phone. You can then use COVID Connect to retrieve your results via your cell phone, or you will receive an SMS once your test results are ready. To receive your results on WhatsApp, just add Let's Talk to your phone book on 082 0468 553. Type in results on WhatsApp and follow the prompts. We look forward to many of our people taking part in this track and trace system. Thank you very much.